I had a total hysterectomy. What hormones should I take? Well, it depends on various factors. First of all, age is important. Is somebody postmenopausal versus premenopausal? What are your reasons for taking it? Hopefully the ovaries were left in. Most of the time we do recommend, especially under the age of 55, 60, 65, that we prefer to leave the ovaries in most situations unless there's cancer or some sort of genetic issues going on. Then if your ovaries are still in, or even just one ovary, that's usually fine. You don't need to take a hormone replacement if that's the case. There's enough estrogen in one ovary to accommodate for that. If somebody is after menopause and they're having a lot of menopausal symptoms, usually hot flashes, night sweats, irritability, those are very, very common. There's lots of different treatments for those, some of them non-hormonal. The hormonal ones typically work really well. The current guidelines in general are to take the hormone replacement after menopause for as short a time possible to help with the symptoms. There are a few percentage of patients who continue to suffer tremendously with menopausal symptoms even for many, many years, the rest of their life. In those cases, it's very reasonable after you talk to your doctor. Typically an OBGYN would be the best person to discuss this with, of hormone replacement, the pluses and minuses of it, your specific situation. If somebody's had a hysterectomy, they can just do estrogen alone. They don't need the progesterone part. If you haven't had a hysterectomy, then it is important to do both. When it comes to a lot of the negative side effects, the progesterone is really the culprit in many, many things. For years, estrogen got a bad name, but in the end, it is truly the progesterone that causes most of the problems. So women who've had a hysterectomy, even if their ovaries are in or out, doesn't matter, then they can do estrogen alone, and that can be very helpful for a lot of conditions. And there is some downside, but it is pretty minimal.